Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm fine, thank you.
Dr. Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, a viewer-submitted question, and our lone U.S. COVID statistic through today, April 10th. We invite you to submit any questions or suggested topics down below in the comments or at any of our linked social media. Starting with that COVID statistic, average COVID deaths per day in the last reported week were down to 46, whereas the same week in 2024, we saw 121 daily COVID deaths. Dr. Murphy, your reactions to those numbers?
Yeah, basically unchanged from the last couple of weeks. We've got the death rate down below 50. Remember, that's one of the last markers to really change. But the wastewater activity is low for most parts of the United States. You can still get it, but it's obviously on the way down. So this is like the end of the winter respiratory virus season. So that's where we are. And the good news again is much fewer deaths than last year. So, last year at the same time, it was 121 deaths per day, and now we're down to 46. So it's a good sign that overall the community is healthier and more protected, most likely from all the vaccines and all the infections that people have had. So there's this herd immunity.
Mm-hmm. Following up on that, our submitted question today is that statistically, when one compares the number of COVID deaths from the same date as we just did, is part of the reason that the death count is going down is that there's less people that are extremely vulnerable to COVID, i.e., those people have passed on.
Well, I'm sure that contributes something, but it would not be enough to account for this big of a drop. It is the most at-risk people are the ones dying from flu and from COVID and from respiratory syncytial virus, all these respiratory infections. So it's true, but the big driver is the herd immunity that has keeps increasing in the population as more and more people get infected and more people are taking the vaccines. So it's all a combination. So there's truth to what is being said. But it's not the whole story and not the major driver. It's a minor driver.
Right. So one of many factors.
One of many factors.
Now, before we move on from COVID, there were two very interesting studies, both with large study populations, that studied COVID-19 vaccination during pregnancy, that safety, and also showing that potentially pregnancy itself may offer some protection against long COVID. Can you break down those two studies for us?
Yeah, no, this is some encouraging news, particularly about safety of these vaccines and their overall impact. You can do this now because we do have access to these large databases around the world. And this one looking at pregnancy. So there's a lot of people in this study. 78,000 pregnant individuals eligible for COVID vaccination between 2021 and 2022, and they compared the prevalence of major structural birth defects in this cohort. They didn't find any difference between those that had the vaccine and those that didn't. So it's like some 13,000 had the vaccine and 65,000 did not. Those are a lot of people. And they found that there was really no difference. Matter of fact, the crude difference was 156 per 10,000 pregnant women versus 160 birth defects per 10,000 live births in the unvaccinated ones. So the vaccinated ones had a slightly lower, but it's statistically insignificant. It's actually the same. The point is, it's not even it's not increased at all, and very safe in terms of birth defects, because everyone seems, one of the big concerns, oh, my kid have a birth defect. They had, 1,248 significant birth defects. I mean, birth defects happen out of 78,000 pregnant women. But there was no difference in those that had the vaccine and didn't. So that was really very encouraging news. And then in a different study, they looked at pregnancy itself in women and found that the ones that had the vaccine had fewer cases of long COVID than the women that didn't take the vaccine. So it was about half as many of these pregnant women had long COVID if they had the vaccine. So they probably protected them from getting the vaccine, but it also protected them from getting long COVID. Hundreds of
very interesting results.
Yeah, 72,000 women infected with COVID during pregnancy versus 208,000 women who were not pregnant but got COVID. So interesting findings. So the point really is the vaccine works in whether you're pregnant or not, and it doesn't cause really any problems and may actually alleviate long COVID in many people. So
which is very good news. Yeah. Now, some not good news here in the US is that the measles outbreak has continued to grow, and there has unfortunately been another death. Can you break down where we are right now and all that's happened?
Yeah, it's very sad because measles is a preventable disease. Remember in 2000, we didn't have any cases, not even cases. We hadn't had deaths for a long time. And so this is the second child, a child who's 8-year-old girl. And there was two kids got measles and died in this group from Texas, primarily from Texas. And there was one adult who died. None of them were vaccinated. And, it's resulted in a number of hospitalizations. And in a hospital in Lubbock, Texas, they found that of the hospitalized patients, many of them were very sick because they had liver problems from taking too much vitamin A. Now, this has been promoted. Vitamin A has been promoted to treat measles. And in areas of the world where vitamin A is deficient, it can help. But in the United States, we don't have big vitamin A deficiency. And not only do these kids not need vitamin A because they're not nutritionally deficient, like in the studies that showed that it helped, but the vitamin A can cause toxicity, liver toxicity, that may have actually made these kids even sicker and put them at risk even for dying of liver disease. So it's just craziness to promote vitamin A treatment. It doesn't work for prevention, and it doesn't work for treatment unless you're vitamin A deficient to begin with. So it is just a very sad situation, and people have to be careful what they take because you can buy vitamin A over the counter.
Absolutely. Very concerning number there. I believe the exact number was not released, but the hospital said fewer than 10 of those pediatric severe measles cases, the kids also had liver problems from that vitamin A.
Right.
So the best course of action here, still be vaccinated against the measles.
Be vaccinated. Even Mr. Kennedy recommends vaccination can prevent the disease. He admits that. But they've just cut funding for many of the clinics that give the vaccines out, and they're still promoting these really bogus treatments, which is unfortunate.
Very unfortunate. And another unfortunate story, we have a string of those today, is that a young girl in Mexico has died of the avian flu. It was the country's first case. Can you share any more details with us?
Yeah, all we know is that a 3-year-old has died of avian flu in Mexico. So another death from avian flu was not associated with human-to-human transmission, so that hasn't changed. In the US, we have 70 confirmed cases. It was all related to animal exposure. So There's still no evidence of human-to-human transmission, but it's a potentially lethal disease, and we have yet another one in a child. There were several other reports in Cambodia. Some children also have died from avian flu. And so, we just have to continue to watch it. We've culled over 168 million birds. It's just all very unfortunate, but it is being studied. There's a vaccine available if we need it. And I mean, that's the status of avian flu right now. If we start seeing human-to-human transmission, we're in a lot of trouble.
Yes. And our final story for today, also a sad one. There has been now published research documenting and estimating the consequences in terms of lives that the US's exit from programs like PEPFAR, USA, the WHO could have on HIV patients specifically. Can you break that down for us?
Yeah, PEPFAR stands for the President's Emergency Plan for AIDS Relief, started in 2004 by George W. Bush. In conjunction, it was a bipartisan support, congressional support to move this program, and it was hugely, hugely successful. As a matter of fact, when it was started, a lot of people said it couldn't be done. They were very, very skeptical of this program, and it was gigantically successful, and they estimate has saved 26 million lives since its inception. I was originally the country director for PEPFAR in Nigeria back in 2004 through the Harvard School of Public Health, where I had an appointment at the time. And I mean, it was really a phenomenal program, and just highly, highly successful. And then it was very successful, and we transitioned the control of that program to the Nigerians, and other countries were doing the same thing. Somewhere between 5 and 15 years after the initiation, we got out pretty quickly. We became advisors to the program for after the first 5 years, and then we were out completely, and they've done everything themselves. It's just been great. Not only that, but under the Obama administration, they started combining, making the services more comprehensive, and really strongly encouraging the buy-in from other funding entities, including the ministries of health in all the countries that were getting benefit. And over the years, the private expenditures and these other government expenditures increased from 13.7 billion per year to 42.6 billion. So, it really tripled during that time, and was continuing to increase every year. The goal was to really get them more self-funded and sustaining, and not relying on the American money, which was up to $6 billion per year. But what's happened now, I mean, that was a goal, and we were at least going in the right direction. But to just cut off the support for PEPFAR has just blown this huge hole in the whole medical system, because the governments and the other NGOs and potential funders, they just can't fill a hole that big that quickly. Now, if they had a couple years to transition out, I mean, it would be okay. But what the epidemiologists at Oxford University have predicted is that there's going to be at least 1 million children will become infected with HIV because of this, and 2.8 million will be orphaned because their parents will die from HIV. And the number of HIV cases, of course, is going to increase, not only in new people infected, but in the people that have lost the access to the medicine. I mean, unfortunately, with HIV, you have to take the medicine every day. And as soon as you stop, it comes back. And we're basically taking this giant step backwards in this whole thing that was slowly getting under control. And to cut it short like that is just like if you're diabetic and all of a sudden you have no insulin, what happens? Well, nothing good. And that's what's happening with this because of the abrupt pullout. And the faith-based institutions and the government and other funders, they just can't fill the gap that quickly. I mean, they're going to work very hard to try to do it, but in the meantime, basically, you're going to lose millions of people. We're going backwards.
Yeah, I mean, just absolutely catastrophic results. And on that note, I'm sorry we did not have happier stories today. That's just the way it goes. But thank you very much, Dr. Murphy, for your time and your expertise helping us understand all of these changes.
Well, thank you, Katie.
And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. If you have any questions or suggested topics, whether that be things you want Dr. Murphy to discuss or questions about the things you saw today, feel free to leave them down below or at any of our social media. We'll see you next week.
See you next week. Have a great weekend.